Hey everyone, and welcome back to A Sip of Aesthetics. Before we jump in, we want to take a second to thank you. Because of your support, this show has quickly become one of the fastest growing podcasts in the aesthetics world. We appreciate every listen, every share, and every message. Today, we're doing something a little different. We've pulled together a few staff favorites, some standout clips, expert tips, and fun moments from the past episodes that really stuck with us. So whether you're new here or you've been with us from the start, you're going to love this mix. Let's get into it.
And it's a hub for these kind of treatments. A lot of like the new treatments, a lot of the companies, they have headquarters in LA, and so a lot of the conferences that are always happening are happening in this area. I love LA. I love it. It was because of that field. And you met spa, the specific spa that we're in, it has its own unique story too. When we came to LA and started that.
Sculptra is an injectable that is like a watery solution that triggers collagen stimulation. You do that treatment over the course of about a year, and you come in for 3 to 4 treatments typically to achieve a goal.
Like you said, there's some people that don't want so many steps, so that's why Epicurus is so nice. I mean, you're able to kind of just do a dropper full of the serum and put it all over. I love that you're able to put it all over your eyelids. I put it in my lips. I'll put it in my nose if it's feeling dry. Like I'm bringing it all the way down here. And it's just nice. It's like one step, and then you can just put a touch of cream on top, instead of having a separate serum for this and eye serum for this and moisturizer and then a topper moisturizer. It's about finding what works for the patient. And especially, I think, too, men like something that absorbs really nicely and doesn't feel heavy or like a film on the skin. So there's, certain sunscreens that I have, used over the course of the years and that we sell here that I'm like, your boyfriend's going to love this. Your husband's going to love this. It's easy. It absorbs. There's no white cast. Trust me. I've seen it all. They're going to love this one.
It's one of my favorite treatments right now. Patients are loving it, and you just heal so quickly from these treatments, which is one of the biggest benefits of it.
Hey guys, it's Dr. Adam with A Sip of Aesthetics, and today we're talking about under eye fillers. So we're going to cover this topic in details. We're going to talk about who's a candidate, who's not a candidate, what is under eye fillers, what are some other treatments, what are some things to watch out for.
There's a term that people use now called biohacking, and that it's within that realm. So basically it's a biostimulatory injectable. It's a watery solution with poly-L-lactic acid kind of dissolved inside it. And that can be injected anywhere around the face or body, but will, over the course of months, thicken the dermis with new collagen. And you can get kind of pan-facial revolumization, but in a very natural way.
Now, Sculptra is, a medication. It has to be injection. It has to be done with the, right provider. So any specific advice for somebody who wants to do Sculptra, like, I'd imagine you definitely want to get it from a licensed physician or, provider.
Yep.
The chemical peel, you can also control the strength of the peel, which will kind of control the downtime. So trying to find that kind of perfect balance where it's, not crazy downtime, but it is enough to kind of for the peel to do what we need it to do.
And then the energy-based devices really become important in their 40s to just maintain the elasticity and firmness in the skin. And I usually tell people that where they start is where they stay over time. So if you start those procedures in their 40s, they will very gracefully age. They'll still age, but you can maintain it so well. You can maintain a really healthy skin quality and not have to backtrack so much compared to if they wait until their 50s, for example.
If somebody's listening to us and they're like, I kind of want to give this a try, and obviously you want to make sure you are a good candidate, you talk to your provider, but what should they expect in terms of like, when do you see the results? Is it something where it's like immediate, where you see the full effects, or do you want to give it time to get the full results?
So if you were speaking to somebody's
wife or someone that's trying to get a gift certificate for their husband or their boyfriend, where should they start?
So you pretty much always have to be a little cautious. It's just the degree is going to be different if you're doing something that's like going to really sensitize your skin, like an IPL,
Yes.
versus a different treatment.
So we actually got a new one here at New Med Spa, and it's called the DECA. And it's great because unlike old traditional lasers, like the CO2 lasers, where you go in and you get your entire face burned off and you're like hiding for about 2 weeks, this one is really non-ablative. It takes about like 30 minutes to like an hour to do. And the recovery time is about 5 days. And it's almost like a light peel. And it's FDA approved for acne scarring, fine lines and wrinkles, texture issues, elastin production, collagen production, like you name it, it does it. So it's one of my newest procedures to do that I really like, just because the downtime is substantially so much lower than before. Thank you.
We're going to be talking a little bit about the CO2 laser today, a very popular topic. I think many of our listeners have heard of the CO2, but if you haven't, that would be a good kind of introduction-like video. We'll talk about what a CO2 laser is, what it's used for, who would be a good candidate, all that kind of stuff.
And then where can you do PRP? Because I know I did PRP on my face and I loved it. So where else can you do it? You mentioned injection, so I know joints.
Yes. Well, to a few things, but if I had to kind of pick one thing, I would say add volume would be the main thing. So fillers are made of hyaluronic acid. It's bonded in a specific way so that it can last a little bit longer. But your body is always making and breaking down hyaluronic acid. As we age, part of the aging process, our skin changes. Part of these changes is our volume distribution changes. So in other words, certain areas of our face will lose volume.
I think just being consistent at least twice a year, coming in the office, getting an assessment, reinforcing the skin quality and the collagen, the dermal thickness with something like Radius, Sculptra, some of our lasers, and just maintaining healthy skin is the gold standard. And then maybe consulting for surgery as they get closer to 50, late 40s and then 50s for sure.
I know you see like a lot of patients, every day, and you try to educate a lot of these patients. Like, which patients do you see that you think like, okay, this person is going to be a great candidate for endolift? Like, what is it, about their skin or about what they're looking for that might, make you think I should probably, talk to that client about endolift?
Pico laser is a great option for all skin types. I love that laser, especially for darker or melasma prone, because it's not using heat so much on the skin. It's very gentle, and it's an actual laser that can target deeper in the epidermis or dermis to kind of break up that pigment.
If you've heard the term Juvederm or Restylane before, or now there's RHA, Teoxane, Bolotero, all of these are dermal fillers, which is a very popular treatment in the aesthetics field. The aesthetics industry has been around for a long time.
With any of the options that you just listed and that we talked about, typically it's a process where you come in for a series of treatments, sometimes 5 treatments over the course of a year, sometimes 3, depending on how severe the pigment is. There is another option that's a little more aggressive, CO2 laser. That's been around since the 1960s, but has improved in its technology so much over the last 10 years about. And with that, you can target deep and superficial pigment for a proper candidate. And you can essentially treat pigment a little more aggressively so that you're not bound to so many treatments at once over the course of a year. Over the course of about a year, if patients have never done Sculptra before, they will come in for a series of treatments. Usually I split mine into 3 treatments, and we determine the dose, usually based on their age or their skin integrity. But they'll do anywhere from 4 to 6 vials on average over the course of 1 year to build significant collagen. And then it's kind of a once a year treatment indefinitely. And my Sculptra patients just maintain their skin quality so well. They don't feel like they have to come in for other treatments as readily as the patients who don't do Sculptra do. After the injection, they can have mild swelling and soreness, and they massage the face for about 5 days afterwards. Over the first month, they usually get kind of a glow within the skin and a little bit of fine changes, but it takes the body about 100 days to form new collagen. So really, it's between 3 and 5 months that type 1 and type 3 collagen is actually produced in the body. So it's a gradual change. I would say, in general, treating the skin is going to be one of the most important pieces to the puzzle long term. And the skin quality can really kind of age a patient's face. So if they have healthy looking skin, even if they're volume depleted, they look very healthy and bright, as opposed to people who don't approach their face with skin tightening treatments. Of different pieces of the puzzle. I explained that neurotoxins help with fine lines in the upper face and are only affecting the muscle. Fillers are used to address volume changes in the face and to create structure. And then the salmon DNA, or VTech, is our specific product that we carry here, actually addresses the skin quality. And as the human ages, about 80% of the aging that happens in the face is within the skin itself. So collagen loss, elasticity changes, loss of strength. And only about 20% has to do with bone, fat, or volume changes. So it's important to address all 3 pieces of the puzzle, but the salmon DNA actually addresses the most important piece of the puzzle and keeps the skin strong and youthful.
Cadaver courses.
Yeah.
I think every injector should have done at least one cadaver course. Like, it's so important. It's so important.
No, you have to know your anatomy.
Anatomy. And I still, like, some providers don't like aspirate in certain areas that are a little bit more prone to dangers. I'm an aspirator, and I'm sure you are too, because we just want patients to be safe.
And I do agree. I think that's a really good point, that you can use an IPL sometimes for active acne, sometimes for pigmentation, and you would adjust the settings, as you've said, to kind of be able
filters,
to target it
different settings. Yep.
more often.
I think that hollowness, it needs to be explained to the patient a little bit more. Like, I think I'm a pretty good example of hollow, where like my skin is like down to bone. There's nothing squishy, there's no tissue. That is a true hollow under eye. And that is the person that is a great candidate for under eye filler.
Endolift, one of the things is it can take some time to see the results, but that's also because you are building collagen. So it's kind of, the results will end up lasting, a good significant amount of time, just because it's kind of happening from the inside out.